the way I look at these things, you're always going to have unintended consequences. The people least capable of predicting them are our politicians. They somehow or another just never get that it's going to happen. They never prepared for it. They pretty much blow it every time. But you can look at what motivates individuals, what motivates businesses, what motivates organizations to do something specific, and you can pretty well guess what direction it's going to go. I really would like to stand here and say that what I predicted 4+ years ago with the little essay I wrote, The Culling of the Herd, that I was wrong. The sad part is I was right, and the sadder part is that it's happened faster than I thought it would. So, anyway, somebody here has got questions. Run.
I sat through a lot of presentations in this room, and that's one of the best I've heard. Well done.
Well, thank you very much.
But
Okay.
you skipped over an issue that's bothered me for a long time, and that is when and how did physicians lose control of their industry?
Good question. Probably Medicare. That's pretty much it. Medicare was the beginning of the loss of control. That's conventional wisdom answer.
Do you take Medicare patients?
Oh yeah.
You take new Medicare patients?
Yeah, it's about 30. At one of my offices, about 35% of my practice. At the other, a little bit more.
So is the Medicare problem you just referred to then the fact that Medicare might say to you, if you do a procedure 12, we'll pay you $100, and you have to accept that as your compensation. Mm-hmm. But then Joe Bloggs comes into your office and he has no insurance. Mm-hmm. And you say, Joe, you need a procedure 12. Mm-hmm. And he says, how much is that going to be? And you say $1,500. Mm-hmm. And he says, oh, geez, I don't know if I can afford that. Is that the?
Well, here's the deal. You're hitting on something that's it's one of the really weirdest things about Medicare. There's something called the most favored nation trading status clause in Medicare. It basically says if you give somebody else a price that is lower than what you charge Medicare patients just once, we can assume that you've done it many, many times in your practice. We can fine you for having done that, and then we can expand that out to your entire practice, and we can run it back 7 years. So let's say my price for procedure is $1,000. I like that better than $100. So anyway, and somebody comes to me and says, tell you what, will you do it for $700? I say, sure. Medicare comes in and says, oh, you've been charging us $1,000 for this. I say, yeah, but you're only paying me $700. Doesn't matter. You've been charging us $1,000. And you gave this other person a price of $700. So you've been cheating us. Then we're going to extrapolate that and assume you've done it to 30% of your practice, and we're going to take all those patients who are on Medicare, and then we're going to fine you, say $5,000 per patient, plus we're going to want the money back, and then we're going to extrapolate that back 7 years. That's how the law is written. So basically, you must leave your fee schedule where it is, and you must accept what Medicare gives you.